is the Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us.
The first question.
I'll ask it. So you said that right now your sort of powder is a powder form that you add to your water.
Yes.
So a couple of things. Number one, I thought most animals get their sort of hydration through food rather than just water. And then typically too much electrolyte could also have negative effects. So how are you ensuring that the right amount is being added, especially if you're adding?
First off, I'll answer the food question because that's a great insight you have. A lot of our customers use this product as a food topper. So they pour the powder into water, they put it on top of their pet's food, kind of like adding milk to cereal, and their dogs really enjoy it that way. We have a dosing criteria on our packaging. So the rule of thumb with pets is that no pet should drink more ounces of water than their body weight. So if your pet weighs 50 pounds, they should be limited to 50 ounces of water. And we also have a safe potassium and electrolyte mix that's for all breed sizes of dogs.
And you have sales currently?
Yes. Yeah. So the 25,000 and pre-sales or the 25,000 in the beta sales when I was selling the liquid product. And then we just currently opened up the website and I haven't done much marketing for the powdered product yet, but we do expect sales to come in, especially as we're starting to launch on Amazon.
During the beta sale, did you allow for reorders, and did you have any reorders out of the beta sale? Have a better understanding?
Yeah, so I did allow for reorders, launched the subscription model in beta sales. The average order value was about $38 off the website. The average lifetime value of a customer was about $250, and some customers passed $425, $450 in sales.
What was your estimated CAC be on the pre-sale line?
So I use the customer retention model, modeling 25% to keep it conservative. So every 4 months that customer churns off. So it's about $250 customer lifetime value at the improved price point that we're offering.
Yeah, I just had a safety question. You said there's chicken broth in there?
Yeah.
Chicken broth, obviously broth, bacteria can grow in it. Have you guys done any studies or looked at that at all?
We did whenever it was a liquid version. So we had to use preservatives to preserve the product. As a powdered version, it's shelf stable until mixed, and then we said use within 48 hours after mixing the product in water.
Yeah, but you haven't, looked at how long that was sitting in the bowl or.
No. So we say use it within 48 hours, but it doesn't sit in the bowl longer than 60 seconds after pouring it in with my dogs. So.
Are there any other companies that are doing this hydration?
There's companies that do like functional benefits, so supplements for dogs. The problem with that is it can be very difficult to get dogs to drink supplements. And I'll give you an example. So if you were to add a teaspoon of sugar to your coffee, you would be able to taste that teaspoon of sugar. If you were to add a teaspoon of sugar to 1 million gallons of water, a dog's nose would be able to detect that teaspoon of sugar. So whenever you start to add supplements or things that don't register with a dog's brain, they tend to shy away from it. And that's why I believe the category hasn't had someone to kind of plant the flag and become the leader.
Do you know a company like Pause? AWS. It'd be interesting for you to get I think that was the name of the company. It was a plug and play company up in Silicon Valley, and it sold. It was dog food, I think, some aspect of food, not hydration. But you should get a sense about how much they raised and what kind of a sale that they had. I think it'd be nice, information for you to have when you go to people, because I remember it got really good value, and it would be helpful for you to have that, to show that there is a big market and there's buyers out there for these kinds of pet food.
Yeah.
Whether on the hydration side or otherwise.
That's really great. And that brings to mind a story from the Amazon folks that are managing our Amazon listing. Last year, they launched a brand. It was a vitamin for dogs. They launched it at 0 revenue. In 1 year, it took off 5 million plus in revenue. So the category is absolutely massive
Yeah.
for health supplements or healthy living for your pet. And I've seen that within my small
It's huge
sample testing.
market, so
Yeah.
that's good for you.
Like, one last question? Go ahead.
So a couple of questions. One, your beta, what was your add to cart and what was your conversion rate on the beta sales?
So the average value was about $38. So that's not,
What's your add to cart percentage? Like what percentage of people that came to your site added
Mm.
to cart and then what was your overall conversion rate?
So the add to cart, I don't have the conversion rate is about 1%.
1%.
Yeah.
And then is there anything that's patentable about this? Can you patent this approach that you have?
The current ingredients that I don't, a lot of it's being built into brand equity, especially with the space being wide open, we're locking up a lot of trademarks.
Where are you located, by the way?
Fort Worth.
Fort Worth. Texas.
Let's take that clicker right there, click to the next slide.
Okay, great.
There you go. You're definitely ready.
All right, I'm ready. Well, great to be here today. Brookings is actually our attorneys up in Seattle.
Yep.
Love them. And I've been in the healthcare industry as a physician for about 35 years. Before that, I was actually a professor at the University of Washington. And today I'm going to tell you about something I've been working on for about 10 years with my great team. And it's based on it's really a transformative technology, and it looks very simple, but it took us literally 5 years to optimize this for iteration. Initially, we used it to close wounds and did very well. And then we discovered that it could be used to treat pain. So any device, which I'll pass around later, has incredible pain relieving properties, and particularly chronic pain. And that's become more of our story today. That's what I'm going to talk about. So as I said, I'm a Stanford and Yale trained academically great physician. I've started a number of biotech and med device companies, a couple went public on NASDAQ, and here today to tell you about Predator. So we're based on a technology which we call micropoints. These are tiny, almost hair-like little tips in an array, piece of backing, fly like a patch, backed by a very strong IP position, which we've developed around this. Originally used to close wounds because by putting these little tips in, you're able to close wounds with strength sutures, very attractive, like just like a Band-Aid. So the last 2 years, we sold over 500,000. Currently, we've had no safety issues, and over 500,000 sold. Also on the medical market, as well as a consumer. Revenues, over $5 million, cumulative revenues, sell on nearly all Walgreens and CVS stores. And CVS has been taking off like wildfire this year, last year, compared to this year, 70% year over year increase. Sell with a variety of different packaging, as you can see. But what happened was, about 2 or 3 years ago, we actually discovered that this same little tiny product could be used to treat pain. Kind of amazing story, which we'll talk about in a minute. Turns out chronic pain, which I've had since medical school, is the most common medical disorder. 50 million Americans have it. And so it represents a huge market opportunity and an unmet medical need. So what happened, and it's our story, I gave this to one of our investors. He actually lives 2 miles from here. Orthopedic surgeon, chronic back pain, had quit practicing. Oh man, about a week later, couldn't believe it, put it on his back. I'm like, you're crazy, his back pain went away. I then used it on me. My back pain went away. Gave it to one of our board members, esteemed physician, former president of American Society of Plastic Surgeons, Honcho, a VP of medical affairs at J&J, called me next day. This thing works so well, nobody's gonna believe it, Ron. And he's a tough guy. And so the next 2 or 3 years, started giving it to people for a variety of different conditions, chronic pain conditions, hip pain, neck pain. Even now we've done plantar fasciitis, we've done tennis elbow, just a lot of different conditions, and found this works tremendously well. I've been using it myself for 3 years. It's a life changer for me because I've had so much back pain. It's unbelievable. What's the advantage of this? It's drug free. There's nothing in it but those little nano micropoints. Real different from everything else that's out there. It acts within, literally, I put it on somebody the other day, 5 minutes for her, sometimes it's an hour. I'll show you data. It lasts for a long time and it treats severe pain, which most of us chronic pain have. And as I said, the conditions, it just keeps going on and on. in terms of number of conditions that it will treat. And I'm an oncologist, and I've talked about evaluating medical products. We only believe in data, which I'm going to show you on the next couple of slides. We finished our first study in chronic back pain. These are elderly patients. We measure pain on a score of 0 to 10. These patients had an average score of 8, which is considered very severe pain. 18 of them were treated with our pain pause device patch. 5 got a patch with little tiny micropoints, which don't provide pain relief. And we use an FDA endpoint, even though we don't need FDA approval, which is a 30% or more increase in decrease in pain. Data speaks for itself. 17 out of 18 patients met that endpoint. Average pain relief was 60%. Remember, we only need a 30% or more decrease to meet the FDA endpoint. Only 1 or 5 placebo, and that one only had a 31%. So we have to count them, even though 30% is the endpoint. And it lasts for a week in most of these patients. So how does this thing work? Well, as we say, and all pain doctors say, we really don't know, honestly, how anything works in pain. But 3 of us independently who work in this field believe it works through this mechanism. And that is these little cantilever springs actually, when the device is applied, like a patch, push these tiny micro points into the skin. They go right underneath the skin surface, and not like acupuncture where it goes way down. Right there, if you learn in medical school, there are these receptors, basically nerve endings that get activated. They get activated, for example, when you push on your skin when you have pain. We all do that. This is a very concentrated way to do that. And those receptors activate nerves that actually shut down pain, prevent the pain signals from going to the brain. So this is backed by a US patent. Our first one just got issued in May. We have 3 or 4 more coming. It's the same device as our Micromed device, which we've been making at Marion, the top manufacturers of patches and devices in the world. They make products for 3M, many other companies. Most importantly, having spent my life dealing with the FDA when I started this, I'm not dealing with the FDA. So all we have to do with this product is consider minimal risk. It's an exempt device. You simply register it. And then the next day you can sell it. There's no approval process. This is a big problem. 40 million Americans out of the 50 million with chronic pain have it due to musculoskeletal disorders. Most common conditions, I'm sure you probably know, are back, neck, knee, and pain, and hip. But don't forget plantar fasciitis affects millions of people, tennis elbow, 5 million people, a lot of different conditions. Where we've shown it works. Most of us fail healthcare treatments. That includes steroid injections, surgery, PT, you name it. And then we end up with severe pain. It doesn't go away. The average person has chronic pain, for 11 years. We all are in desperate need of something that works and something we can use at home. So naturally you think of consumer products. Oh, they could be used at home. What's the problem? They're only act for a few hours, most of you know. Pain patches, the creams, even these, 6 to 8 hours. They don't treat severe pain. And I don't put it on here, but they have safety issues. As doctors, we're not supposed to use these in people over the age of 50 for more than a week. These have lidocaine. FDA in March came out with warnings on the use of lidocaine topically. So that's an issue now that's become apparent. So patients don't have options. So what do? A lot of them need them on narcotics. Big problem, as you know. So what does ours do? We use those little painless metal micropoints that activate a natural pathway to relieve pain, provides long-lasting relief, treats severe pain, and I can attest to that. Easy as applying a patch, completely drug-free, no chemicals, none of that. And I would say unique among almost all the consumer products, and I live and die by clinical trials. I'm an oncologist, clinical proven. And we have more trials coming. And we're doing a knee pain study here in LA, 2 blocks from here after I have to leave early because we're starting a plantar fasciitis study with podiatrists. We're going to do studies, prove this stuff works. I don't want to put things on the market unless they work. Key advantage of this, one product can treat almost any musculoskeletal condition. So you don't need products like, like a salon pass, your different sizes, all this. You don't have it, and that only lasts for a few hours, but this one product, we're using it for all these different conditions. So pricing. So ours is priced in a little envelope, just like our Micromed, different packaging artwork. 2 patches for $26 and 4 patches for $36. This should give you a month pain relief, 7 days for each patch. And like I talked about before, subscriptions. You got pain like I do, you're going to keep using it, and you're going to go on a subscription model. Not everybody will, but a lot of people. Margins are very high, and they'll get higher and higher as we get higher volumes. And we have the advantage because Micromed, Pain Pause, same product. So we get advantage with that. So for most of these products, you go direct to consumer. What your own website is actually important. Obviously, Amazon. I'll mention that our Amazon vendor for Micromed, who will be also doing our Pain Pause, he does over 100 million on Amazon, and he's going to be a vendor for this. Very successful. 25% is pet products, by the way. And first step is for us to optimize messaging and branding, beta testing, and also to identify the best market segments. And then we start a major campaign in November. And then obviously we have Walgreens and CVS. We'll already talk to CVS today about putting our pain product on. And I believe chiropractors are a great opportunity. 40 million people a year see chiropractors. Almost all of them sell products. And so eventually we'll get there. We estimate that based on these calculations that the addressable market is about $6 billion. The individual markets are huge for this. And just with a 1% penetration rate, we can reach $80 million a year in revenue in 4 years. So I said $80 million in revenue in 4 years, 2028. Net income, 33 million, and a high EBIT. Almost all of these companies in the consumer paint space are acquired, either their products or the companies. As you can imagine, nearly every company in the pharmaceutical and many in the medical device, and not only in the paint space, they're in the consumer paint space, and they actually buy topical products, ointments. Salon Pass was bought by a major company. Based on ROI comps, we think we'll get about a 12x in 4 years. Or I should say 3 years, or 24x in 4 years with our company sales. Great team. In addition to myself, I think we have a luminary in terms of making these kind of products, 20 years of experience. This woman is a renowned pain specialist at one of the top healthcare systems that's 5 miles from here. And she's head of pain medicine there. Robert Adele is her co-inventor. And John Kennedy is a luminary, I said before, in J&J and the formulated plastic surgeon. Raising $3 million in a convertible note, the term shown, being used for commercialization. Most of the money is spent on marketing, as you can imagine, key. And we think this will bring in over $6 million in sales next year. And we'll get cash flow positive in 2026. So in sum, we have a really unique technology proven out originally with our Micromed product, and now we've gone into a massive market, treat chronic pain with Pain Pause. As I said, the most common medical disorder, amazing number of people. No good options today. We've proven this thing works. There's no question about it, and I don't say that about a lot of products. Strong patents, launching it in October, so very soon, so why we need the money. Addressable market, massive, and raising the money, as I said. So I'd be happy to answer any questions you have. Thanks.
Yeah, you mentioned the team. Are they all full-time?
Not all of them. We have 4 full-time employees, and Laura Dell, she's got a full-time job as head of pain medicine and anesthesia at their major healthcare system. So she and John Kennedy is the plastic surgeon. We really have more from Micromed, but pretty helpful because of his work at J&J.
So from that group, 4 are full-time.
Yeah, we have about 3. And then we have about 1 or 2 others. So we have about 5 people on our team. It's very small. I like to keep these things small, easy to manage, burn rate low. So we outsource most things.
Are you full-time?
Oh, absolutely. I've been full-time for 12 years. And importantly, I haven't taken a salary for the first 6 years. 0. So, and I put a lot of my own money in this. I've never invested in one of my companies, just personal.
And bro, we start a little further. Can you give us a bit of that history? You know, the genesis of the company,
Sure.
early products.
Yeah.
Pain Pause is really newest to market, right?
Yeah, that's the mind blowing one. But basically, that started out 12 years ago when I was an entrepreneur in residence at the University of Washington. A guy was working on micro needles, which are plastic needles, what a woman using for dermal rollers for cosmetics. I didn't want to do that. So I came up with the idea, take those needles and bend them and make them to close wounds. And then this brilliant engineer came in, said BP Ops, and we were trying to make it a plastic injection molding and mesh. He said, just make them out of metal, just stamp them out. That was an aha moment. We then developed that into a product, and I'll share how we work. We did beta testing. We had some skin irritation. It wasn't a big deal to our marketing group or to our board, but it's a big deal to me as a doctor. That was about 2007, 18. Went back for 18 months, got rid of that with the strings, put it on the market in 2020. And then COVID happened, so we switched to the consumer market from the medical market with the product. And then, as I said, about 3 years ago, our great friend and orthopedic surgeon with the back pain put it on. And that just changed everything. It's like, oh my God. And I didn't believe it. And I was a little reluctant. The defining moment was 2 years ago. I put it on. I didn't put it on. I sent it to the plastic surgeon. I told my engineer, if it works, we're starting this. It worked. Then we did the clinical trial, and now we're doing a bunch of more. The second clinical trial is almost done at back pain. Looks fantastic. The knee pain is early, but so far so good, and we've done other patients.
And you sell Micromed product in market?
We sell it through CVS and Walgreens. As I showed you, the sales are, and Walgreens on CVS and Walgreens increased the price over 50% the last year. And then Amazon, we're actually restarting with our Amazon vendor. He's taking over the whole thing, and he's convinced we're just going to drive the sales up to, anyway, we get about 60,000 a year. On Amazon, we'd be selling 120,000, which will have a dramatic effect on our revenue. We just didn't have the money to do the ad spend we need for a product like that. So that was a problem.
And what's the revenue distinction between the two?
Between, well, we don't have any revenue yet on the other because we haven't started selling. We'll start in October. First year, the ratio will be more, well, next year, actually, the ratio will be about 4-to-1 with pain pause versus Micromed, and then it'll drive up to about 85% will be the pain pause in about 3 or 4 years. So it's going to be mostly pain. Pain is just like a huge market, which is why we went into it. And also, several of us have it. So there's a passion behind it, which is always important, I think.
Right. That's our time.
Yeah, thank you.
Switch quickly. So I guess based on that, I should just leave now because it solves all pain problems. My name is Arjun Rishi. I'm co-founder and CEO of Vodio Health, transforming physical therapy, which apparently you don't need anymore.
I just want to say, I get it every week, and I've gotten it for 15 years.
So for everyone. So traditional physical therapy has a problem, and the problem is it doesn't work for everyone. And there's a lot of reasons for that. And there's about 100 million Americans that have musculoskeletal pain on an annual basis. Vast majority of them never go for treatment at all, and that becomes a major problem as they get older in life. So some of the issues that the employers face. So we have free revenue. We're not direct to consumer. We sell to businesses. So that's where you see individual problems and then corporate problems. So employers, 76% say that their number one cost for healthcare is MSK issues. If you're getting physical therapy from a patient perspective or insurance perspective, it's 12 visits will cost you about $1,500 with some really high number for copay. And then the question is how much time it takes, or how much time you miss at work because of musculoskeletal pain. And so what happens is 75% of people who have MSK pain never go for physical therapy. The ones that go, the minute their pain stops, they stop going. And I'm one of them. I love to run. I get knee pain at times. I've gone for physical therapy, and the minute my physical therapy stop, my pain stops, I stop going. So what is Vodio Health? So we're an end-to-end platform for physical therapy. So you come on board, you see a physical therapist, they do an assessment on you, and then what is done, then our application tracks your progress using AI and other tools to motivate you and what you're doing. And that information now then gets fed back to the care team to monitor your progress. So what we've done to date is we've spent $3.5 million building out our technology, which is really two components, key components to it. There's the vision technology for monitoring your progress, and then augmented reality for gamifying the exercises that you do at home. Part of it is most people don't like, a lot of people are fit, love to work out, especially in Southern California, but around the country, most people don't like to work. They live sedentary lifestyles, and they end up with the largest population is back pain. I think there's like about 45-50% of people have back pain, and then, you know, shoulder, hip, knee, whatever comes up. And so what we've done is we've made your exercises fun for you. So if you have shoulder pain and you exercises to lift your arm, what happens on the screen, there'll be a target with different ranges of motion. And what you're doing is you're touching something. And as you touch that, you're getting visual and audio rewards. And what we're doing is we're using behavioral science to motivate you and motivate, you know, your progress as that happens. So what this leads to is better patient engagement. So all the studies you look at, including the pilots that we have done, we've seen much better completion rates around using our technology than just watching videos and doing exercise at home. Obviously, you have savings because there's no copay involved with doing at-home physical therapy. And then obviously time, you can do this 15-minute workouts, 5 days a week, 3 days a week, whatever your schedule allows. And that allows it to be better outcomes on the other end because more patients are completing their workouts and their recovery plans. So what's our go-to-market strategy? We have 4 sales verticals. Our largest market that we're going after is self-insured companies. There's about 33 million Americans that work for self-insured companies. These are companies that don't have insurance plans. They pay for whatever our thing is. So instead of spending $1,500, they'll be spending, let's say, for an episode of back pain, $500. So they're getting $1,000 saving. And plus, if you're doing a completion, then the chance for surgery, which obviously can cost more than $10,000, is far less. Second thing would be insured organizations and ACOs. And ACOs are large doctor groups that, especially with value-based care, they're getting some of the savings back from the insurance companies if they have. And finally, you would go after payers or insurance companies, but once you get more traction itself. And then we have building some partnerships and some channels with either third-party administrators that they actually manage the self-insured plans, or with benefit companies that actually are selling benefits to the self-insured organization itself. So we just started our commercial activity about 3 months ago. We just signed our first client, Nabel Group. It's a small company in Southern California. And we've already got a couple of partnerships that we're working on. We're working on another organization that has about 100,000 employees that are self-insured, work for self-insured companies. And we believe within the next month and a half, they'll be one of our clients also. And then we've got a huge pipeline of companies that we're working with just within the short period that we've been going outside and pitching our product to them. Market, $1 out of $6 is spent on NSK product in the healthcare space. So out of every healthcare dollar spent, $1 is spent. It's a multi-billion-dollar market in the US alone, and obviously worldwide, it's a huge market. There are companies in this space. Some of them have been around for a while. And the difference is that how we're using AI, how we're using the behavioral science components around motivation, none of them are doing it. We believe we have a 2-year head start in those specific areas, and that's the mode that we're working with. The seasoned management team, this is my third technology startup. I had the fortunate privilege of taking my first company public on NASDAQ. Ty, who's one of our co-founders, was part of my management team. And subsequent to that, he was management team of 2 other companies that have gone public. So we come more from a software background, but we have advisors and members of our team that are from the medical side and from the physical therapy side. So we've got a good mix of medical and of software background. As I mentioned, with pre-revenue, we expect to start generating revenue in Q4 of this year. Our target next year is about $5 million in revenue, and in 2027, about $56 million in revenue. High 85% gross margins. Our KPIs are around patient acquisition and because our first call with every patient is with a therapist, the number of patients the care team can deal at one time is critical to how many, patients we can have on our platform at one point in time. What our ask is doing a $700K safe note at a $7 million valuation cap. We've already raised $230,000, so we're looking for the remaining amount, and obviously would love for you to participate. Thank you.
Is the 2024 estimated or is that legitimate?
So it starts in Q4, so obviously it's estimated. Yeah.
Said you're pre-rev.
Yeah, yeah,
You expect to do that in Q4 alone?
correct.
What's the model? I didn't quite catch the price points for.
So there's multiple revenue streams. So it's obviously within musculoskeletal pain, you've got really 4 categories. You've got chronic pain, you've got acute pain, you can do post and, pre-surgery, and then it's preventative. So our model currently is based on mainly acute pain. So you have an episode of back or knee or whatever it is, any need. So it'd be $500 per episode of pain. So what we're doing is basically reducing, instead of going for 12 visits to a physical therapist, you're doing 1, and then the software is monitoring your progress.
And then showing me the exercises.
So what it does is, the therapist creates a recovery plan. So it could be, 4 weeks, 6 weeks, 8 weeks, whatever the length of the duration of the plan is. And then the patient gets on. So the first week, usually in these cases is more about pain management for the first couple of weeks. We do exercises, stretches. We show you how to do the exercise. And then what happens on the screen, it ends up where there's basically, so let's say you're doing a squat. You'll have a line that's around your knees, because that's really the maximum range of motion, and maybe 1 halfway through. So depending on what your range of motion at that point is, with the exercise, you touch that target on the screen, it counts. Let's say you're supposed to do 10 reps, or let's say if you're doing a plank and the plank, you have to hold the position for 10 seconds. It knows you're holding the position when you end. It captures all that data, and that information is fed back to the care team. And the care team wants, they can actually, use an animation to play as if you're doing the exercises and see exactly how you're doing it.
And those materials are provided.
So there's no material, just using a camera. So all we do is use your camera. We don't take video of you. We just basically, track your joints. So all the joints get lit up on the screen, with dots. And then we capture that information, and we can then recreate that on the back end for the care team to watch.
How are you screening your physical therapist?
So they have to be certified. Yeah. I mean, well, obviously you interview them besides that, but yeah. I mean, they have to be certified, to be able to, they have to pass the board exams to be a physical therapist. So there are 3 levels within the care team. You're a physical therapist that's certified, you're a PT assistant, and then the wellness coach. And all those have actually certain education requirements. And so, and anybody can't just show up and be a physical therapist.
You mentioned earlier, I might have misunderstood. I thought you said you had computer vision, but then you just mentioned now that you're not taking video. How are you doing reinforcement learning on your computer vision model?
We track their range of motion. So when you talk about reinforcement learning, it's a question of reward based on, what success you have.
No, reinforcement learning to your model, not to the patient. But I'm assuming that the more people use this, you're going to have better outcomes when it comes to even the predictive model of your.
Right. So, okay. So got it. So you're talking about building a system that allows us to understand what exercises work for what profile of patient coming on board. So obviously, right now we don't have enough patients to do that. It would happen at, 12 months, let's say, point in time to say. So right now, what's happened is we build these protocols for, depending on what the patient profile is, they're built by hand right now, right? So they're preset protocols for, male, female, height, weight, pain level. Here's what the exercises need to be. Those protocols are built. But then what we do is we track that information as it goes out, and then those models can be fed back. And you would then look at those models and say, okay, which exercise worked? Because what we do is we know that, so you assign an exercise to somebody and it's not easy for them to do, then we know that, or it's too easy for them to do, we know that, and that would be then fed back, and then the model can be revised.
Do you have an in-house model?
Yeah.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.